Dear students, welcome back. In the previous session we have discussed about transverse dorsal joint axis which is related to the transverse dorsal joint function. So in the transverse dorsal joint function we have seen two axes. One is the oblique axis of the transverse dorsal joints as well as the longitudinal axis of the transverse dorsal joint. So this proposed longitudinal and oblique axis for the transverse dorsal joint indicate a function which is similar to that of the subtalar joint, isn't it? Yes. So because these two axes also producing the supination and pronation with same components, that is triplanar movements with same components, but magnitude is different, and this longitudinal axis predominates the inversion and eversion component in the supination and pronation, whereas the oblique axis of transverse dorsal joint predominate dorsiflexion, plantar flexion and abduction, and adduction components predominate over inversion and eversion motions in supination and pronation. Okay, now so the subtalar and the transverse dorsal joints are linked mechanically so that any weight bearing subtalar motion, any weight in the subtalar motion causes the talonavicular as well as calcaneo-cuboid joint to move simultaneously as well. So the weight bearing on the subtalar joint causes simultaneous movement of subtalar joint along with talonavicular and calcaneo-cuboid joint. Okay, for example, as the subtalar joint supinates, subtalar joint supinates, what happened? The linkage to the transverse dorsal joint, the linkage towards the transverse dorsal joint causes both talonavicular joint and calcaneo-cuboid joint begin to supinate. With subtalar joint is, for example, when the subtalar joint is fully supinated and locked, that means bony surfaces are drawn together, the transverse dorsal joint is also carried into full supination and its bony surfaces are similarly drawn together into locked position. When the subtalar joint is pronated, then what will happen? Pronated and loose packed, the transverse dorsal joint is also mobile and loose packed. Okay, so in fully supination, keep it in mind, in fully supination only the talonavicular and calcaneo-cuboid joints are also drawn together and into a locked position. In pronation it becomes loose packed. Okay, and the transverse dorsal joint also become mobile and loose packed. The transverse dorsal joint is the transitional link between the hind foot and the forefoot. Okay, so which is serving, so this transverse dorsal joints are going to serve, serving to add to the supination and pronation range of the subtalar joint and compensate the forefoot for hind foot position. That means here the compensation means the forefoot remains flat on the ground. Forefoot remains flat on the ground. That means this becomes relatively immobile during while the hind foot is that is talus and calcaneum pronates or supinates. So if the hind foot is going to supinate, the entire foot is not supinating. Okay, so this one is brought about by this transverse tarsal joint. Whether the hind foot is pronated, the forefoot is not pronating, and this one is carried out by this transverse tarsal joint. Okay, so here the compensate the forefoot for hind foot position. That one is done by this transverse tarsal joints. Okay, so what do you mean by the compensation? The compensation is to the ability of the forefoot to remain flat on the ground while the hind foot pronates or supinates in response to the terrain or the rotations imposed by the leg. Okay, so the first of the transverse tarsal joint function can either in the weight bearing foot or in non-weight bearing foot. Okay, so that is the first function, and the second function required some closer analysis. So that one we are going to discuss now, that is weight bearing hind foot pronation and transverse tarsal joint motion. So again here also we are going to take the model of Inman and Mann's mechanical model. Here we are taking the same model here. So normally in the weight bearing position, medial rotation of the tibia. So this is the leg component and this is the subtalar component and this one is the foot component here. Okay, now in the weight bearing position, medial rotation of the tibia, okay, medial rotation of the tibia as occurs. For example, if somebody pivots this leg on the fixed foot, okay, which imposes pronation on the subtalar joint. That means the subtalar joint also pronation. Okay, so if the pronation force continued distally through the foot, the lateral of the foot would tend to lift from the ground, diminishing the stability of the base of support, resulting in unequal weight bearing and imposing stress at multiple joints. But this is an undesirable effect of weight bearing subtalar joint pronation, and this may be avoided if the forefoot remains flat on the ground. This can occur if the transverse tarsal joint is mobile. So this not during this pronation of the subtalar joint, the forefoot is not moving, then we will get some stability. If forefoot also moves along with the subtalar motion, we will not get stability. So that stability is brought about by this transverse tarsal joint. Okay, so what happens now here? So if the transverse tarsal joint is mobile and can effectively absorb the hind foot pronation, so then what happens? when the talus and calcaneum move on an essentially fixed calcaneo-navicular or fixed navicular-cuboid unit. So once the transverse tarsal joint, that means that is fixed, that is navicular-cuboid unit is fixed, there is a relative supination of the bony segments distal to the transverse tarsal joint will occur. So what is happening here? The leg is rotated here, okay, that is medially rotated, and the subtalar joint is also pronating along with this leg, okay, and then the subtalar joint also moves along with the proximal segment, that is towards the leg segment, and this subtalar joint movement will takes place on the fixed navicular-cuboid joint. So once these segments move towards the medial side, that is medially rotated tibia and pronation, what is this joint here? The transverse tarsal joint, that is the segment here, navicular-cuboid joint is relatively fixed for this movement. So once these are moving medially, the forefoot remains constant, it is not moving, but because of this movement of this two segment appears the forefoot segment, which is relatively supinated, but this is actually the forefoot segment is fixed, okay. That means here the forces of this medially rotated tibia and subtalar movement forces are taken up by this or absorbed by this navicular-cuboid joint in pronation, okay. Yes, the transverse tarsal joint maintains normal weight bearing forces on the forefoot while allowing the hind foot to absorb the rotation of the lower limb. Now here we can observe these things in this Inman model, okay. So in the first pic they nicely represented how a medial rotatory force imposed on the leg acts through the oblique axis of the subtalar joint and through the transverse tarsal joint to maintain the forefoot in a relatively fixed position. Note that fixed forefoot has effectively moved in the direction opposite to that of the hind foot segment, okay. So Inman and Mann's model indicates that when weight bearing hind foot is pronated, the transverse tarsal joint will supinate, move in a direction opposite to the hind foot, that is relative movement. However, in reality the transverse tarsal joint is relatively free to move either into pronation or supination, which mainly depends upon the demands of the terrain, that means the ground or floor, because both subtalar and the transverse tarsal joints are loose packed. In a bilateral standing position on level ground, both the subtalar joint and transverse tarsal joints pronate slightly, okay, to allow the foot to absorb the body's weight. As a result of pronation, there will be a slight medial rotatory force on the leg, okay. As a person moves into a single limb support and begins So this one we can see here. Okay, in bilateral standing position on level ground, both subtalar joint and transverse dorsal joints pronate slightly. Here both the things are pronate slightly, presumably to allow the foot to absorb the body weights. As a result of pronation, there will be slight medial rotatory force on the leg. Okay, as a person moves into single limb support and begins to walk, the subtalar joint will continue to pronate, whereas the transverse tarsal joint will move in the direction of supination, approximately an equal amount to maintain proper weight bearing in the forefoot. During walking on uneven terrain, as long as the hind foot is in pronation, the forefoot can move either toward supination or pronation depending upon the demands of the terrain. For example, there is a rock under the medial forefoot. During walking, the transverse dorsal joint may move into greater supination to maintain appropriate contact of the forefoot with the ground. Okay, so that is the thing happening during bilateral standing and single limb support and moving in uneven terrains. Okay, if the supination range is not available at the transverse tarsal joint, the rock may also force the hind foot into a supinated position. Okay, putting the lateral collateral ligament at risk for injury. With other surface demands such as standing sideways on a steep hill, the uphill foot must pronate substantially to maintain contact with the ground. So therefore pronation may be required at both the subtalar and the transverse tarsal joints. As long as the subtalar joint is in some degree of pronation, both the subtalar joint and transverse tarsal joints are relatively mobile and free to make compensatory changes to maintain the contact of foot with the ground. Okay. So here this is the position of supination, that is the supination substantially to maintain appropriate weight bearing of the forefeet on uneven terrains. That means here on uneven terrains, for example, here a rock is present, then what to maintain support on this rock uneven terrain, the forefoot is going to supinate, whereas the leg and the subtalar causes some pronation there. Okay, so these are the things we can see in weight bearing hind foot pronation and transverse dorsal joints. Now we will see weight bearing hind foot supination and transverse dorsal joint movements. So the same thing which is going to happen exactly opposite to this, but it is having some limitations. Now we will see what is going to happen in supination. Okay, so here also we can take that mechanical model of Inman and Man, a lateral rotatory force. Here we can find this lateral rotatory force on the leg will create subtalar supination. So here the subtalar also undergoes supination in weight bearing, and with a relative pronation of the transverse tarsal joint. Here with a relative pronation of the transverse tarsal joint. Okay, that means opposite motion of the forefoot segment to maintain appropriate weight bearing on the level surface. Okay, so this is the position. Okay, so to maintain the relatively fixed position when there is a lateral rotatory force, here the subtalar joint also rotates laterally, but this transverse tarsal joint is pronated to maintain the relatively fixed portion of the forefoot segment. Okay, yes, because in weight bearing the forefoot has to be leveled on the ground, then only we will get the stability. Okay, supination of the subtalar joint, however, can proceed only to a certain point. So this is very, very important. So such kind will not continue for a higher degree of supination. So this supination can be maintained in this position to a certain point before the transverse tarsal joint also begins to supinate. So that is the limiting point of such kind of position. What is that? That supination of the subtalar joint, however, can proceed only to a certain point before the transverse tarsal joint also begin to supinate. As bony and ligamentous structures of the subtalar joint draw the talus and calcaneum close together, the navicular and cuboid bones are also drawn towards the talus and calcaneum. That is, transverse tarsal joint mobility is increasingly limited as the subtalar joint moves towards full supination. So this point I have mentioned earlier. That means during full supination, so here the compensatory mechanisms is not going to work. So the remaining bony components are going to supinate along with the subtalar supination, that is towards full supination. With increasing supination of the subtalar joint, so that is which is caused either by the terrain, that means uneven terrain, so that uneven terrain causes supination, or by increased lateral rotatory force on the leg, the transverse tarsal joint cannot absorb the additional rotation but begins to move towards the supination. So that is the second case. So it can't hold that increased lateral rotatory force, and this joint also starts to supinate, which also causes supination of the forefoot. Okay, so in this thing we can see the subtalar rotation will begin in this segment in the B. It causes begin to supinate with greater range of subtalar supination and lateral rotation. If you can observe this lateral rotatory force and this lateral rotatory force, the lateral rotatory force is increased, or when we stand on uneven terrains, that one also increases the lateral rotatory force, which causes supination of the subtalar joint after to an extreme point of supination, which causes to begin supinate at this transverse tarsal joint. Okay, in this third one, this one is fully supinated subtalar joint, and maximum lateral force of the leg, which also causes the forefoot segment to supinate along with this subtalar supination as well as the maximal lateral rotation of the superimposed leg. So these are all the functions of weight bearing hindfoot supination and the transverse tarsal joint motion, as well as weight bearing hindfoot pronation and transverse tarsal joint motion. So in the next session we are going to discuss about tarso metatarsal joints. Thank you.